What types of data are collected for each of the three APP clinical measures? For example, what is being extracted for the follow-up part of the depression screening?
There are, of course, three measures currently required for the APP. Our submissions are typically built from separate analyses of denominator and numerator data. Now, there are other ways to build these, and we may find with you that there's a better way to structure your submission, but it typically works great with this approach. Denominator eligibility is determined from claims data. Claims data always contains name, date of birth, diagnosis codes, and service codes. That data set nicely and accurately defines the denominator for each of the three APP measures and pretty much every other measure we may need or want to do with you. For the diabetes hemoglobin A1C measure, we need A1C data, which nearly always exists as a number in your EHR accessible to simple data query tools. The exception to that is numbers you might receive through a fax system or a document and you may not have the process that takes those numbers and puts them into the database. For the hypertension measure, blood pressure control, blood pressure nearly always exists as two numbers in every data system. A systolic and diastolic number are each associated with the dates that they were done. They're recorded in your EHR database and accessible likewise to simple data query tools. Now, data for a depression measure is a bit more of a challenge, as you've suggested, and we may need to get creative with you to satisfy the depression measure. Now, if you're setting up your system new, I'd set up whatever you use for depression screening as an orderable and resultable test. That means we can recognize its existence and its results electronically. And I would set up the variety of actions you might take on a positive screen as orderable items. The existence of those orders then satisfy the second part of the depression measure, requiring action on positive screens. Now, failing either or both of these configurations steps requires chart abstraction to correctly characterize your performance. And a more complex electronic search can satisfy that action on positive choice. We can and do often search for medications. We search the meds list for an antidepressant. We search referral orders for behavioral health referral or next visit order for a reevaluation visit. Anything else you might choose to do to manage that positive screen. So there are some easy ways and some hard ways to do this, but it can be satisfied in every organization somehow, and we're looking forward to the opportunity to problem solve that with you. Thanks for the great questions, Jason.